Welcome to Books in Sum, your go-to for bite-sized book summaries.
The Body Keeps the Score by Bessel van der Kolk. This book discusses how trauma affects the body and mind of people who have experienced trauma. It explains why traumatic experiences haunt us, how trauma patients perceive their environment, and how trauma can be healed. It also explains why war veterans only trust other war veterans, why an ordinary picture in a magazine can trigger horrifying thoughts, and how yoga relieves trauma patients of their pain. Trauma is incredibly common in our society, with 12 million women being victims of rape in 2014 alone and 3 million cases of child abuse every year. Traumatized people often suffer from post-traumatic stress disorder, which can lead to depression and substance abuse. They also tend to mistrust anyone who hasn't experienced the same suffering they have, and assume that nobody can understand them. These experiences can change the lives of those affected, as well as the lives of their friends and family. The author studied the impact of trauma on PTSD sufferers in an experiment. He listened to a recording of a script that recreated their traumatic experience and inhaled air with a tiny concentration of radioactive particles. Marcia, a 40-year-old teacher, was first up for the experiment, and as she listened to the script, her blood pressure and heart rate rose sharply. Activity in the left half of her brain, the side responsible for rational thinking, slowed down and effectively deactivated. This deactivation makes it difficult for PTSD sufferers to realize that the things they hear, see, and feel during a flashback aren't real. In Marcia's brain, the Broca's area, the area responsible for speaking, showed a significant decrease in activity, leaving her unable to speak. Her stress hormone levels shot up and stayed high. Childhood trauma has negative impacts, not just in a person's youth but well into adulthood. The author demonstrated this in an experiment in which cards with pictures from magazines were shown to children who had experienced trauma, and those who hadn't. The traumatized children imagined that one of the children in the images would smash the father's head with the hammer he was holding, or that the car would fall, crushing the father's body. These thinking patterns often persist into adulthood, and Marilyn, one of the author's patients, was sexually abused as a child, a traumatic experience that shaped her life as an adult. Marilyn's case may sound extreme, but many others who were traumatized as children continue to suffer in their adult lives. Traumatic memories are vivid, unchanging, and easily triggered, and when we tell stories, we tend to embellish, exaggerate, or omit parts of our experiences. The most important details in this book are that people remember things differently over time, and that traumatic memories don't change over time. The author demonstrated the difference between these two ways of remembering by asking participants to recall important but non-traumatic events in their lives, like the birth of their child or their wedding day. When participants were asked to recall traumatic memories, smell, taste, touch, and hearing played a far more important role, and the memories remained consistent for well over 45 years after the war ended. EMDR allows patients to integrate their memory and restore a sense of agency over their mind and body, using only a finger moving back and forth across a patient's field of vision. EMDR, or eye movement desensitization and reprocessing, is a technique used to help PTSD patients integrate traumatic memories into their memories. It helps a patient control their relationship to traumatic events by allowing them to integrate it into their memory and develop a new and healthier relationship to a traumatic memory. This has been achieved through EMDR, such as when Kathy approached the author at 21 years of age after having just attempted suicide for the third time. Kathy was able to observe her traumatic memories and repackage them in a way that gave her agency over them. After 8 sessions of progress, Kathy made a remarkable recovery, and 15 years later, when the author reconnected with Kathy, he was happy to see a healthy and happy woman who was considering adopting a third child. Yoga offers trauma sufferers a safe way to explore the relationship between their body and mind. Yoga is a healthy way to cope with overwhelming emotions in the aftermath of trauma, and it is essential for trauma sufferers to get in touch with their emotions and understand how the body experiences them. Annie, one of the author's patients, decided to give it a try, but the first yoga classes were difficult for her. Despite this, she stuck with yoga and noticed that her body was constantly sending her signals about her emotional state. Yoga helped Annie come to terms with negative sensations like these and helped her realize that she could deal with them head-on, rather than repressing them. Mindfulness is a powerful tool for trauma recovery and can alleviate the psychological and physiological impacts of trauma, from depression to stress. Neurofeedback helps trauma sufferers rewire their brains, allowing them to change the brain waves they produce and encourage the production of alpha waves to help them relax and keep calm. It can also improve immune responses, activate regions of the brain that help regulate emotions, and balance out stress hormone levels. Supportive personal relationships are essential on the road to recovery from trauma, and networks can be formed through AA meetings, religious congregations, and veterans organizations. Know the effects of trauma on mental and physical health, and the use of mindfulness, support networks, EMDR, yoga, and new techniques like neurofeedback to help trauma sufferers cope with and recover from their trauma. Lisa, a 27-year-old woman and one of the author's patients, experienced years of trauma and self-destructive urges before she began neurofeedback treatment. With her newfound ability to produce alpha waves and consciously make herself relax, Lisa was able to talk about and work through the traumatic events from her childhood. Neurofeedback is still rarely applied, but with a broader acceptance of mindfulness and improved knowledge about mental illness, there is good reason to be optimistic about the future of mental health treatment.
We hope you found this summary helpful in your listening journey. If you're interested in diving deeper into the topic or getting your hands on the whole book, be sure to check the description below where we've included links to the book and other related products that may be useful to you. Don't forget to hit that subscribe button to stay updated on our latest book summaries. And feel free to leave a comment with any suggestions or requests for books you'd like us to cover. Thanks again for tuning in and happy listening.